one day lifted up my left arm in front of a mirror and just spotted like puckering on my breast from my nipple downwards, so it wasn't a lump or anything that I could feel, and just quite a shock really to just see that.
Initially everyone kind of thinks cancer, oh well that's it then, that's the end, but yeah, thankfully no, it's not, you know, thanks to early diagnosis these days, you know, everyone's got a much better chance.
I'm proud to say Spire has a breast care nurse all the time around. No breast cancer patients goes without her input into their care, and they bring a lot of very close communication with the patient. They link the missing links between the pathologist, radiologist, oncologist and the surgeon, theatre. They are the backbone of the whole breast unit.
Undoubtedly the best part of my job is developing relationships with patients. I feel very privileged to be able to go on a journey with patients at what is probably the most difficult time of their life, and I think you often develop a really good rapport with patients, their families, and I feel if I can just make a little bit of difference to their journey, then it's really worthwhile.
The Lakeside Suite or chemotherapy unit is a very close-knit community. There are only 4 or 5 people here, and we have got breast care nurse Jill Farrington. So they all know each other and they know me very well. So we are a very, very sort of close community. There's no waiting time, so they're seen early. Some of the patients have started treatment on the same day, which obviously is great.
When I moved across to Genesis, again, I think Jill sort of introduced me, so that was all nicely handed over. I found them really professional over there. Again, that was quite a nice place to have to go.
Spire Little Aston's excellent in that we've got a very close-knit team, and that I get an opportunity to speak to all the consultants involved in the patient's care and the breast care nurse, and that means that the patient has continuity of care and that everyone's involved in decision making. It often changes their life, particularly if they've lived without a breast for a while. They feel like it completes the treatment and they can get on with things back to normality.
The Living With and Beyond Cancer Group has been established at Spire Little Aston since 2017. From what I understand, it's been evaluated really, really well, and we go through 8 sessions, meeting once every 3 to 4 weeks.
The group that was set up has been really useful. It's so useful to talk to people that have been through the same as you or similar to you, and to be able to compare notes with them and to support each other. And I think a big part of the group has been that peer support. When the physiotherapist started me on the programme after I'd had my surgery, and I realised that it was the Pink Ribbon programme and it was Pilates based, that helped me anyway because it felt comfortable because I was familiar with a lot of the movements. It's really important to do those exercises, and it made me feel good.
The Pink Ribbon programme is divided into 4 phases, and the phase is designed to help progression on from restoring flexibility to improving strength.
Anyone that just found out that they'd got cancer or suspected they had, just never be frightened to say if you've got something that's worrying you. Just deal with it, because it's more of a problem if you don't. And you could end up lying awake at night, making yourself more poorly by worrying.
Every member of staff that I've come into contact with has made it really, really positive. I can't speak highly enough, if I'm honest, about every nurse, every consultant that I've come into contact with. It's been great.